So here we got somatic symptom disorders. It's a big group of about 5 different disorders that relate to the body. Soma means means body, and therefore all these kind of relate to a lot of physical symptoms. So we're going to start out with somatic symptom disorder. Where better to start? So defined, it involves having, by the way, this is number 11, so 10-1. Somatic symptom disorder. Significant focus on physical symptoms such as pain or fatigue to the point that it causes major emotional distress and problems functioning in day-to-day life. Symptoms are specific sensations or pain, shortness of breath, general symptoms such as fatigue or weakness. Treatment involves cognitive behavioral therapy, family therapy, and antidepressant medication. Many researchers are really not satisfied with research being done. There's just really a lot of lack of knowledge from a lot of psychologists that have this disorder, and so really studies are being done, but there's not a lot to show for it right now. Really, they're just focusing on like how do we diagnose this, how do we evaluate what symptoms should be associated with somatic symptom disorder. Illness, anxiety disorder, this would be number 12. Illness, anxiety disorder. So it's defined as a preoccupation with and a fear or having or acquiring a very serious disorder. Patients are so preoccupied with the idea that they are may become ill, that impairs social and occupational functioning and causes significant distress in one's life. So really it's just like, oh, am I going to get sick? Am I going to get sick? I'm not going to go out. I've got to keep washing my hands. I've got to keep using some kind of disinfectant. This is very similar to an OCD, maybe comorbid with some kind of OCD disorder. They examine themselves repeatedly, looking at their throat in the mirror, checking their own skin for lesions. They're very easily alarmed with somatic sensations. This, I think at one point was called hypochondriac, being a hypochondriac illness anxiety disorder. Some patients really visit doctors very often, or even are avoidant of medical care because of the fear of becoming sick somehow. Treatment includes serotonin reuptake inhibitors or cognitive behavioral therapy. Patients can benefit from a trusting relationship with a good physician, a really good doctor. If symptoms are not adequately relieved, patients may benefit from psychiatric referral while they continue under the care of a primary doctor. Current research findings are being done that really, as said before, the treatment, it's really about a consistent, compassionate relationship with a doctor that's really going to help a patient, as well as some medications. Moving on to 13, 10-3. This is conversion disorder. So conversion disorder is defined as physical symptoms that resemble those of a neurological disorder. They're commonly triggered by mental factors such as conflicts or other distresses. These symptoms that I was talking about earlier, it's like paralysis of an arm or leg, some loss of sensation in the body that really can't be explained. Difficulty swallowing, loss of special senses such as vision or hearing. Some people report just going blind, even though there's really no indication that this should be happening. Treatment, hypnosis may be helpful to enable people to control their stress and other mental states. Narcoanalysis is rarely used. It's a procedure that's similar to hypnosis, but they're given a sedative to make them drowsy. This is interesting. I've never heard about that before. Psychotherapy includes cognitive behavioral therapy. It's effective for some people. current research findings. New brain imaging is really helping to find what parts of the brain are turning off, because if there's no other way that it can explain the fact that someone will be blind, but something must be going on in their brain. So researchers are getting more detailed pictures into the brain and seeing maybe what's going on. It's actually supporting some of Freud's contentions that he had earlier about a person being traumatized. Maybe that has a lot to do with the brain imaging aspect of it. Also getting back to there's some kind of trauma that induced these really strange symptoms. Here we go. 14, so 10, 4. Defined, it's a fictitious disorder where a person acts like they have some kind of illness. They're deliberately producing or feigning some kind of symptoms. There really aren't any good psychiatric medications for this disorder, because, I mean, you wouldn't really prescribe, if you knew something was being faked, you wouldn't want to prescribe any medications for it. However, there are some SSRI, selective serotonin reuptake inhibitors, that can help manage these problems. Family therapy can also help in this kind of therapy. Families help to better understand their relationships. Why is a sibling doing this, and how can they better help that person's need for attention, perhaps? Researchers found that monitoring is also a form, a method that can be really helpful for a patient's own good. Can be, it may be helpful. I mean, some of these people do need to be monitored. So he says here, even fake illnesses and injuries can be dangerous and might be monitored for fear that unnecessary surgery may subsequently be performed. Oh, okay, I'm understanding that now. So some people would go in faking this kind of illness, and if you know that they are faking this, but a doctor doesn't, there could be some kind of dangerous thing that happens. So really, these people just need to be monitored. Okay, that's the end of that one. That's all of somatic symptom disorders. Thanks for watching. Thanks for bearing with the awkward pauses. Just trying to figure out my notes today.